Now, we have another abbreviation, and it's one that you better put a star by, put some pretty colors on, get some stripper glitter and sprinkle it, something. It's RSV. It is always popular and important for you to know RSV. It does still kill babies. And I know of at least 2 children that are gone now. It is typically not a big deal in healthy children. Even adults can get RSV. But it can be very deadly in the high-risk child. Now, of course, you have to know the full name. It's respiratory syncytial virus. Respiratory syncytial virus can still kill premature and low birth weight babies. This RSV, the reason why you want to really pay more attention to this disease is because it's the only respiratory condition under contact precautions, because it is contagious in so many ways. It's contagious through contact, so it's contact precautions. It's a respiratory condition, so droplet precautions. And then if I treat it with ribavirin aerosol, I just made it an airborne precaution. It can be all 3. Now, the guidelines have suggested, and you have to know this because it's brand new, the guidelines have suggested that these children can be put in what we call cohorts. Cohorts. You really want to put this down, new stuff. Cohorts. Because many of these babies are in cribs. And the nurses that are taking care of these children can't take care of anybody else. So you can put more than one RSV together. Cohorts. Please highlight that word. Cohorts is a group of similar conditions. So you could have a cohort of Somalians in Columbus, which I do. You can have a cohort of RSV children at Rainbow Babies and Children. You can have a cohort of patients that have suffered from anthrax, you know, whatever. It's a group, okay? So this cohort, you can put more than one child with RSV in a cohort, and usually it's like this big room with cribs in it, okay? Big cribs. So this is important for you to know. Now, technically there's no like vaccine that we give routinely for this. So we give high-risk children what we call Synagis, more like a immunoglobulin, but we don't routinely vaccinate against RSV. One of my beloved students who's been an RN now in pediatrics for maybe 4 years now, she was in our little commercial. She was working, she was studying for the NCLEX exam, and her best friend has a 2-year-old that came down with RSV, was very sick, and someone fed that child. And what you need to know is when a child is in respiratory distress, you don't feed them. When anyone is in respiratory distress, you don't feed them. The risk of aspirating is very high. And this child aspirated and died. And the funeral was the day before this student, now nurse, it was the day before her NCLEX. And her best friend, after the funeral is over and you're at the home with the dinners, you know how you do, you're trying to gather and support each other, and you usually have meals and all this. Her best friend said, enough of this. Get those flashcards out. You've got a test to take tomorrow. Tearjerker. She passed her test, but that bond between the two of them is ridiculous. She will never forget her best friends at her child's funeral worried about her test the next day. So you don't feed these children who are admitted in such serious respiratory distress. You don't feed any child, so you know you don't feed epiglottitis anyway, but you certainly don't feed anybody that's really suffering with, you know, rapid respirations and just having a hard time with their breathing. You don't do that. C-Diff is not going to be C-Diff necessarily on the, oh yes, doctor.
Brief question.
Yes.
You mentioned the cohorts, and I want to ask a question. The reason you call it cohort is because there's no additional contamination.
Not these kids, and plus the nurse can't take care of anybody else, so she's stuck. No cross-contamination there. Yeah, just stay all your little RSV people together. And they're babies, right? You know, they're babies, so it's going to be a little bit easier in cribs. They're not walking around doing whatever. Okay, C. diff, Clostridium difficile. So Clostridium difficile, as you know, has many, many risk factors, most of which have to do with your physiology. You had to know your physiology for this one. What is it about the elderly and their physiology that puts them at risk for C. diff? Decreased hydrochloric acid in the stomach, right? So they don't produce as much hydrochloric acid, and as we've said before, acid is put there by God to fight infection and, you know, really kill germs and everything else, and they just don't have that makeup there. They don't have that as much as you do. There's another risk factor for C. diff, and that is surgery. What kind of surgery? Gastroenterology surgery. So GI surgery actually puts you at risk for C. diff. Why? Because we do a bowel prep, and we clean out all the good flora that would have been able to fight the bad. Another risk factor, as you already know, antibiotics. And even though penicillins and cephalosporins can cause it, we know that the #1 drug that causes C. diff is what? Cipro. So your fluoxacillins, I mean not your fluoxacillins, but your fluoroquinolones. Your fluoroquinolones include Levaquin, Cipro. These are very much associated with C. diff. It's not an antibiotic, but what drug categories are also going to put the patient at risk for C. diff? What other drug categories, using your knowledge on physiology? PPIs, very good. PPIs, what do PPIs do? Decrease HCl. So proton pump inhibitors, H2 antagonists, they're going to decrease the HCl, making the patient more at risk for C. diff. Think that through. GI surgery, elderly patient, PPIs, antibiotics post-op. You seeing a perfect storm? Okay. And this is really bad. It's really hard. Now, you know yourself that we try to treat it with what kind of antibiotic category? Aminoglycosides. We like to throw Vanco at this person, don't we? But don't we have to remember that if this patient is elderly, they could have diminished renal function? So you're going to be watching the BUN and creatinine, even if they don't have diabetes or some other kind of reason to think kidney failure.